After 10 years of playing soccer, I've always wondered what my coaches meant when they said, close your eyes and visualize. When I asked about it, they just said that visualization will help you perform better. But I've always wondered why. My name is Courtney Okumura, and the purpose of my research study was to test the effectiveness of visualization on the performance of adolescent athletes. The sports environment can be highly stressful to athletes because it's highly competitive. Specifically in soccer, cognitive anxiety is a nervousness caused by a lack of concentration. Pre-performance evaluations have a stronger effect on cognitive anxiety and are shown to cause a decrease in performance on cognitive tasks. Somatic anxiety is when players feel symptoms of increased heart and breathing rates and feeling sick. Somatic anxiety primarily affects performance on motor tasks that require fine neuromuscular actions like aiming at targets. Anxiety in sports can have varying effects on athletes, such as less enjoyment and a decrease in performance. However, studies have shown that your brain actually plays a huge role in your athletic performance, and using the right mental training can help you improve without actually stepping onto the field. Researchers have been testing the effectiveness of mental training programs, such as the use of goal setting, positive thinking, self-talk, and guided visualization on athletes over the past years. Visualization prior to sports competition allows athletes to feel comfortable in a competitive environment and enables athletes to prepare for what is going to happen and how to cope with potential problems. Sports visualization is used to remove negative triggers in athletes' brains and replace them with positive thoughts to sharpen focus and create self-confidence. It also promotes relaxation and allows athletes to feel more in control, which leads to higher optimism and self-esteem. So, how effective is the use of visualization on improving a soccer player's ability to shoot a free kick? I hypothesize that if players go through a guided visualization exercise prior to their kick, then they will have a positive difference in means between their baseline and experimental tests for the accuracy of their kicks, which is measured by the distance between the ball and the target, and sports anxiety levels of each component: worry, concentration disruption, and somatic anxiety. I use a sports anxiety scale pictured here to analyze the emotions and pre-competition anxiety levels of my participants. Some examples of questions included phrases like, I feel nervous, or I'm concerned about choking under pressure. And participants were asked to choose one of the options: not at all, somewhat, moderately so, or very much so, based on how they were feeling. Individual sport performance was assessed by analyzing the accuracy of the free kick. During the kick in a lower stress situation, the goalkeeper was the source of anxiety for the shooter because the attention of the kicker could be shifted to the goalkeeper rather than where they want to aim in the goal. During the kick in a high pressure situation, a defender was running at the shooter to increase the defensive pressure. The visualization exercise was self-administered using a recording that consists of both relaxation and guided imagery components. Participants using the guided imagery recording were asked to imagine themselves successfully shooting a free kick into the goal and to imagine their environment and emotions during the experience. Participants were also asked to visualize their shot before each trial. The recording is modeled after Eke Ochoa's guided imagery, which involves multiple senses such as visual, auditory, kinesthetic, and emotions. Guided imagery techniques utilizing multiple senses has been found to have a greater effect and benefit on athletes because it allows them to be more mindful of their senses and environment while also enhancing the experience in one's mind. So here's a few seconds of the guided visualization exercise that participants used.
Close your eyes. Imagine yourself getting ready to shoot. Picture how your cleats feel on your feet, what the grass smells like, and how the sun feels on your face. Now imagine yourself walking backwards to line up for your shot. Envision the target that you want to hit in the goal and the path the ball will take to get there.
There are two groups in the low pressure experiment, one control group and one visualization group, each with 5 participants. In the high pressure situation, only 6 out of the 10 participants from the first round of data participated again. As shown in the figure here, participants in the visualization group performed a baseline test on the first day. They filled out the sports anxiety scale, then shot 20 free kicks while trying to aim at a target in the top corner of the goal. On the second day, they underwent a self-administered visualization and guided imagery exercise prior to taking the sports anxiety scale and shooting the free kicks. As shown in this figure, the control group performed the same baseline procedure on both days and didn't do the visualization exercise. In both experiments, I recorded a video of each participant's kicks and extracted photos showing the position of the ball, which was analyzed using Image J. This photo shows the layout of Image J. As you can see, the distance was measured from the center of the ball to the center of the target 3 times for each kick, which is indicated by the yellow line. The mean of the 3 measurements for each kick was taken to reduce error. Using the 20 averages, an overall average for the distance was taken for each participant's baseline and experimental test. Those were then used to calculate the difference in means between the baseline and experimental data. I also calculated the scores for the sports anxiety scale by adding up values from the questions in each category. As shown here, each answer corresponded to a 4-point Likert scale, ranging from not at all being 1 and very much so being 4. Each question corresponded to one of the 3 components. For example, the question that reads, "I'm concerned about choking under pressure," is associated with the worry component of anxiety. The differences in the baseline and experimental scores for each participant were calculated. The box plots of data pictured here suggest that the difference in means for the distance between the baseline and experimental test of the visualization group was greater than that of the control group. The data was statistically significant at W equals 25 and p-value 0.0079 using the Wilcoxon sign rank test. Additionally, the box plot on the right of the difference in means in the high pressure situation shows a drastic difference and no overlap between the visualization and control group. The 2 box plots show the results of the worry component scores for both the low and high pressure situations. In both figures, the mean difference of the visualization group was greater than that of the control group. Here are the results of the concentration disruption component scores. Like the previous component, the difference in means for the visualization group was greater than the control group, indicating that participants in the visualization group had lower levels of concentration disruption after using visualization. This is the data for the 3rd component of somatic anxiety. Once again, it shows that the visualization group had a greater difference in means than the control group, indicating that visualization was effective at lowering levels of somatic anxiety as well. Results showed that the visualization group performed significantly better than the control group. A positive difference in mean distance from the target for the visualization group supports my hypothesis that players using visualization will see an improvement in the accuracy of their shot. By examining each group's means, it was also observed that the visualization group improved their accuracy, while the control group actually worsened. All 3 components of the sports anxiety scale had a positive difference in means, which supports my hypothesis that players will have reduced levels of sports anxiety after using visualization. The data in the high pressure situation also supports my hypothesis and is consistent with the first round of data, in that the participants in the visualization group improved their accuracy and had lower levels of sports anxiety after going through the visualization exercise. The data also suggests that visualization had a greater effect on participants during the high pressure situation. The visualization group in the high pressure situation saw greater improvement in accuracy and even lower levels of sports anxiety than the same group in the lower pressure situation. This is evident in the box plot showing drastic changes between the baseline and experimental tests. My results closely model and are consistent with another study done by the researchers at the University of Alabama, who found that the use of visual motor behavioral rehearsal was effective in improving performance of elite athletes. A significant limitation in my study was a very small sample size of only 10 people. This was due to the state's COVID-19 restrictions, which didn't allow for organized team sports or gatherings of more than 5. Therefore, it was really difficult to gather data in a short amount of time, which resulted in a much smaller sample size than I originally anticipated. Another limitation was that both of my setups for the experiments were not maximum stress environments, and therefore my participants had lower levels of sports anxiety on their baseline tests. Although my second experiment had a higher pressure environment due to the defender running at the shooter, it isn't an ideal high-stress environment like a championship game. However, I was unable to set up an environment like this because of the state's COVID-19 restrictions, which didn't allow for competitive matches to be played. Further research will need to be conducted to gather a larger sample size. This would allow for larger generalizations about the population as a whole. Further research would also allow for the examination of the time component of visualization by conducting multiple trials for each participant to test if their visualization skills improve with more repetition. If I'm able to in the future, I'd also like to test the effects that visualization has in a very stressful environment, such as a championship game or a game at a college showcase. I think it would be very interesting to see if the effects that visualization has on athletes would change under certain conditions. The performance of athletes could be measured by their statistics during the game and a coach's evaluation of the athlete. In this study, visualization was found to improve performance and lessen the sport anxiety levels of participants. I can use the results to start the conversation with coaches about how important the mental aspect of sports is for adolescent athletes, and emphasize the effects that the implication of various mental training techniques like visualization could have. Because mental training is not commonly emphasized for adolescent athletes, the addition of these practices could have extreme benefits for athletes to improve not only their physical skills, but also their self-confidence and mental toughness. The findings and data can also be applied to other sports, not just soccer. A study done by the researchers at the University of Alabama compared the facts of visualization in athletes across a wide variety of sports and found a consistent pattern of improvement for athletes using visualization. Through this experience, I learned how important time management was. We only had a certain amount of time to collect and analyze data, so I had to plan out my timeline ahead of time and try my best to stick to it so I'd finish everything in time. I also learned to be flexible during this process because things didn't always work out the way I originally planned. At first, I was planning on collecting data at a team practice so I could have many participants and I could finish everything in one day. However, due to the COVID-19 restrictions, I had to change my procedure multiple times based on what was allowed while still keeping the basic idea of my project. My advice for future students is to never be afraid to ask for help. In the beginning, I was definitely nervous to ask questions, especially being new to the whole process. However, I quickly realized that everyone is there to help you and it is totally normal to feel confused. I definitely would not have been able to do this without the help and guidance of my teacher and so many others. And of course, I would advise students to never give up. There will be hardships and obstacles along the way, but you just have to keep working and improving because the whole process is really rewarding. At the end, it is really nice to look back on everything you did and to appreciate all the work you put into it. I would like to thank Dr. Chan for guiding me through this process and helping me along the way by teaching me how to do the data analysis in our studio and helping me refine my procedure. I'd also like to thank Mr. Rusty Komori for taking the time to talk to me over Zoom about how he implements mental trainings as a coach with his own players. Thank you to my dad, who helped me collect my data, set up the goal on camera, and check balls during the kicks. Also, thank you to my mom, who took me to and from the field when I had to collect data. Lastly, I would like to thank all of my friends from various soccer teams who participated in my study and sacrificed their time to kick free kicks and go through the visualization exercise so I could collect my data. I wouldn't have been able to do this without all of you. These are my references. Thank you.